subscribe to our channel, and tap the bell button to receive notification about all new videos. 6 weeks pregnant advice, symptoms and what to expect. This week your baby looks like a little tadpole. Your baby is now 4 to 7 millimeters long and the size of a sweet pea. Will develop his or her face this week and will double in size by next week. Fascinating, eh? What's my baby doing at 6 weeks pregnant? You might be feeling the full effects of those early pregnancy symptoms, hello, morning sickness, but the good news is, the folds of tissue are developing that will soon become your baby's face. At the moment, there are tiny openings that will turn into a mouth and nostrils in a few weeks. There are also dark patches that will eventually turn into eyes, and small folds on the side of your baby's head that will turn into ears. Currently, your baby's limbs are just buds, but they will soon develop into arms and legs, with tiny fingers and toes. The spinal cord is also developing rapidly, but at the moment, it still resembles a tail. Your baby's heart will also start to beat around 110 times a minute and can actually be seen on an ultrasound from this week. Common symptoms at 6 weeks pregnant: breast tenderness. You're not imagining it, your boobs are getting bigger and your nipples are pointing out more. They might also be feeling really tender as your body gets ready to breastfeed. Fatigue. Your body is growing a baby, so it's bound to be exhausted. Listen to it and feel free to cancel those dinner arrangements and get an early night. That said, as much as you might not feel like it, try and fit some exercise in, perhaps a gentle walk or a yoga class. The endorphins will help you feel better and it might help you get to sleep. There are also some great superfoods to help fight fatigue. Nausea and vomiting. Whether you're feeling a little sick at the sight of your partner's scrambled eggs, or you're throwing up your breakfast, lunch and dinner, relax and remember, this is one of the most common signs of pregnancy. If you are being sick, snacking is key. These breakfast ideas are great for when your belly is feeling sensitive. Bloating. This one is down to the progesterone that's flying around your body right now. Remember to eat lots of fiber and drink plenty of water to avoid getting constipated, which will only make that horrible bloated feeling worse. It can also lead to rectal prolapse. What should I be doing when I'm 6 weeks pregnant? Book an appointment with your doctor. As we mentioned above, now is the time to book that first appointment with your GP or a local midwife so you can discuss your antenatal care options. At your first of many prenatal checkups, your doctor will give you a thorough check, including a pelvic exam, a smear test, unless you've had one recently, and a blood test. You might be asked to give a urine sample, which you probably won't have a problem providing, and this will be tested for glucose, protein, red and white blood cells and bacteria. Another thing to expect is a lot of questions, so do your homework. Not only will they ask about your own health history, but also about your mum and if she had any difficulties or complications when giving birth. Remember to make a list of questions for your doctor and ask them, no matter how silly they may sound. Stop eating certain seafood, avoid shark, swordfish and king mackerel, but don't worry, you don't need to cut out fish altogether. According to pregnancy guidelines, you can still eat 12 ounces of well-cooked shellfish, canned tuna, salmon or cod a week. Opt for highlights, not a whole head of hair dye. During these first few months, it's safest to avoid the chemicals involved in hair dye. Highlights don't touch the scalp, so that's the safest way to go. Ask your GP if you have any worries or questions. Carry lots of snacks with you in your bag. Dry salted crackers, sweet biscuits and water can be essential for coping with pregnancy nausea. Don't forget to keep an ice cream container in the car if you're prone to vomiting. Keep the lid so it can be easily disposed of. Try not to feel embarrassed if you are sick in front of other people. Many of us have been there and this stage shouldn't last for too long. Avoid any toxins, chemicals, drugs, X-rays, alcohol or generally risky behaviors in this week. Week 6 is an important time for embryonic changes and development. Don't worry if you've actually lost weight in week 6. Nausea and vomiting can lead to weight loss, and there will be plenty of time for you to gain weight and grow bigger in the coming weeks. Make sure you're taking the recommended dose of folic acid and iron supplements. Speak with your GP and/or pharmacist about what's right for you. Thanks for watching. If you like this video, please like the video and leave a comment. And don't forget to subscribe to our channel for more videos.